This morning we went to Landave, a settlement in the Tikin of Nandong, where we've been doing some work in terms of the sanitation and supporting them, and also in terms of helping them with a water project to make sure that they've got safe and clean water for them to drink. We're also here on Tavewa Island, where we've worked with Feel Ready and UNICEF to install 32 water seal latrines that are now being used by the community. We've also noted that they have some ongoing issues with water, so we want to also help them in that regard, really in being able to prevent and stop the spread of LTDs, specifically typhoid. We're grateful that the settlement of Landave and also the village here in Kavea, on the island of Kavea, we've been able to do this together. It's been a journey where we've been able to work together. They've been able to understand also some of the advocacy that we've done in our people coming across to the island. But most importantly, as I've alluded to earlier, is actually continue to tackle LTDs. And they are a challenge in itself, but we want to make sure that we are meeting that challenge. What we want to do is continue to increase our visibility up here in northern Mazuata. I've asked our staff to ensure that they do outreach clinics. We're also looking at strategies in which we want to be able to bolster the work that we're doing in Wanikoro Health Center. Wanikoro has a lab and X-ray and a dental department, so we want to bolster that. We also want to ensure that our nursing stations have the capability to meet the needs of our people. So I'm grateful for the opportunity to be here in Kavea, grateful that we can work with the community in terms of the wash project that we're doing, and really looking forward to a more healthier northern Mazuata, similar to what we've seen in the work that we're doing in Boa.